You have to excuse me if I go into a coughing spasm. I'm getting over something my wife gave me. I'll blame it on her. I would like to thank Ty and Perfusion.com for giving Terumo the opportunity to speak to you, but I would also personally like to thank them because I live about 45, 50 miles from the Canadian border in Washington State, and we still have frost every morning. We had a high the other day of 53 degrees. Woohoo! And it snowed 3 days ago, so it is so good to be in a place where it's warm. I'm going to talk to you this morning about the FX Advance. And I'd like to talk about change, because this is a change from our reservoir. There's a quote that I like that says, if you don't create change, change will create you. And these are 10 reasons why you change. Now, this has nothing to do, some of these have nothing to do with why a corporation changes a product, but I'd really like to, in the presentation, to focus on these. Flexibility, we have made some improvements, the snowball effect, and progress and opportunities. So we have taken the FX Advance, and when I'm talking about that, I'm talking about the oxygenator and reservoir. By enhancing the flow dynamics, we've expanded the patient ranges and hopefully improved outcomes as a result. So what have we done to enhance flow dynamics? We, like many others prior to, we had a curved inlet. And we changed that to or an angled inlet, we changed that to a curved inlet. And by doing that, you'd be surprised the effect on flow dynamics. This effect on flow dynamics also reduced blood turbulence, and that, as a result, enhances gaseous microemboli removal. We have demonstrated in our lab that the reservoir and the 4 and the 3 liter sizes remove about 99.99% of the volume of air that is injected into it. And when you combine the reservoir with the self-venting technology, this air handling performance is effective and in some cases better than some of our competitors. We expanded the use of the FX Oxygenator to a broader range of patients. It was always a question for those that used our R30 reservoir, which is our 3 liter reservoir. And whenever I would get this call as a clinical specialist, where they would say, I was reading your IFU, and I'd like, hold on, you read the IFU? And in our IFU with the R30, it was only rated to 4 liters a minute, but the FX15 is rated to 5 liters a minute. There's a disparity there. And I don't have time to go into why that is, but there was. And so with the flow enhancement changes that we made to the reservoir, we went back and we were able to rate our smaller reservoir to 5 liters. So now those of you that follow the IFU can feel comfortable that you can flow 5 liters with the reservoir just like you can with the oxygenator. Also, because of the enhanced flow dynamics and the improvement in the air handling capabilities, we lowered the minimum operating level in our 4 liter reservoir, the R40, from 200 to 150. And I just talked about this. So by using the FX15, we know that this significantly reduces the prime. This is where you get the best bang for your buck if you do prescriptive oxygenation. And this lower prime definitely decreases the risk of your patient getting a transfusion. The FX15 is used with smaller patients and can have a benefit and best fits your patient's metabolic needs. And because we were able to increase the blood flow rate, now we have more and more customers that are using the smaller reservoir with the smaller oxygenator. And subsequent to the changes that we made with the minimum operating level, we also decreased our minimum operating level for the 3 liter reservoir to 75 cc's. How many, just a question, how many of you use prescriptive oxygenation at your institute? Very good, very good. We're finding that more and more people that are doing prescriptive are increasing the number of patients that they're doing with the 15 versus the 2.5. But if you don't feel comfortable using a smaller oxygenator and increasing its utilization in your operating room, we have the FX25 that has a maximum blood flow of 7 liters a minute, has a priming volume of 260, again, R40, 4,000 in the reservoir with the minimum operating level of 150. So the advanced outcomes. This unique design contributes to fewer blood transfusions in published data and reduced hospital costs. And studies have shown that reducing hemodilution with a low prime oxygenator by as little as 150 cc's is associated with fewer blood transfusions. This is the Ranucci study. In the Ranucci study, their low prime oxygenator was the Inspire 6, and their higher prime oxygenator, and the difference between those two oxygenator primes is only 150 cc's. Yet, with that 150 cc's, because I hear so many perfusionists when I'm out there saying, well, does it make a difference if I decrease my prime by 150 cc's, 200? Yeah, it can. And really what the changes to the FX Advance are, they're incremental changes that could potentially tip you over the point of not having to give a blood transfusion. So as little as 150 cc's of prime volume can potentially make a difference, and in this study it made a difference, statistical difference in acute kidney injury. So really, prescriptive oxygenation is where it's at. I would hope to see more numbers because the evidence is out there that it's really the highest evidence that we have of what we do every day is by decreasing hemodilution, class 1 level A evidence, we can make an impact on our patients' outcomes. All the other stuff that we do, not as high of evidence, and it's more multimodal in its effect. And this is just a comparison of our oxygenators versus some of our competitors. And what we've done is combined the prime volume of the oxygenator and the minimum operating level. And when you combine those two, we have the three lowest prime oxygenators with minimum operating level. So the FX Advance, improvements to the reservoir. It helps you choose the oxygenator that expands your options and advances patient outcomes, and choose the FX Advanced oxygenator. And these are references, and as Forrest Gump would say, that's all I have to say about that. Any questions? All right, thank you very much.
The next speaker I've had the privilege of working with for many years. She worked with me in the anesthesia meetings years and years ago. She's an expert in the field of coagulation and hemostasis. And Colleen, she has pioneered the HMS. She knows it in and out. And I think the value of what we do today is, there was a recent article that she's going to discuss, on the HMS and the value of the HMS. And, you know, how many people are just running ISTAT or ACTs? How many people are using heparin measurement and the HMS? Okay. I think we're going to see, it's kind of a split group, but I think you're going to see the value of what the HMS, and are you using it properly? Are you really getting the best bang for the buck for using that instrument? So, Colleen, thank you very much for coming.
Thank you. Well, good morning, friends and colleagues. It's great to be back in Florida. I, as well as the last speaker, am from Toronto, so this is really a nice treat.